My name is Kaya and I'm a patient of the National Health Service. Last election I voted Conservative, and whilst I can't take back my vote, I can speak about what is happening to the NHS today. I'm going to explain to you why the junior doctors' fight is important. You've heard from doctors and politicians, but let me explain it from the point of view of a patient. The government is planning to impose the new contract as part of their plans for a 7-day NHS. As somebody who was recently admitted to hospital on a Sunday, I can tell you, we already have one. It's a world-class healthcare service and our doctors are fighting to protect it. For years now, they've been shielding us from how bad the gaps in their rotas had become. The fact is, the new contract is part of an attempt to spread the resources of some 5-day services across 7. However, in order to improve 7-day services, you have to provide enough doctors, nurses, beds, buildings and funding to do so, and the government has demonstrated no logical, viable plan for this. If the contract is imposed, it will be the beginning of the end of the NHS. Health is a luxury that is not afforded to all. However, healthcare should be available and accessible to all, because illness and disability are not choices. But the government is currently choosing to underfund and undermine our public healthcare service. At least one of my medical conditions is genetic, and I've been battling with my health from the moment I was born. My mum has been saved by the NHS when she's had meningitis and pneumonia. My grandmother would have died without her triple bypass. My grandpa would have died without his cancer treatment, and my granddad would have died from his appendicitis. You see, without the NHS, all of us would suffer. It's like an elastic band at breaking point. Anyone with any real interest in protecting it would be looking to ease the tension rather than stretching it more. Mr. Hunt said that he would get an extra 5,000 doctors to help with rota problems, but he didn't explain where or how he intends to get these doctors, whilst he imposes a contract so toxic that our dedicated staff are leaving the country or profession in droves, and the number of places at UK medical schools is declining. So I have 3 appeals. To the public and fellow patients, I need you to get behind your doctors. Our doctors are fighting for the future of the NHS, and if you want it to remain, you need to fight for it too. Like some of you, I've actually had an operation postponed myself as a result of the strikes, but it is really important that we allow our doctors to speak before there is no NHS left to speak for. Please tweet your support, write to your MPs, write to the newspapers and make yourselves heard. If everyone who is alive today as a result of the NHS stood together now, we could have this over in an hour. Secondly, to Mr. Hunt, if you're listening, please open your eyes. The contract does not make any logical sense. It's not workable, and you must realise that. Instead of demoralising them, work with doctors towards a contract that helps to fill rota gaps, not create them. Work with them for a contract that encourages doctors to come here and work in our wonderful healthcare system rather than leaving it. Work for a contract that does not discourage research or discriminate based on gender or disability. And failing that, try looking in the land of Oz for those mysterious 5,000 doctors. Whilst you are there, perhaps you could ask the wizard for a brain, so you might see sense on this. A heart, so you can feel the pain and anguish of the doctors and patients. And finally, some courage, so you might admit that the contract is flawed and work with doctors for a contract that is right for doctors, right for patients, and right for the future of the NHS. To doctors, please do not give up your fight. Yours truly is a fight for the future and survival of a healthcare system that, despite its flaws, is the envy of the world. If you lose your fight, we will lose healthcare that is free at its point of use. I am uninsurable in a private healthcare system. I would not even be able to afford the feed that goes down my feeding tube or my routine medications. And if the NHS fails, I will be left to tell my family that they shall just have to leave me to die. I never want you, as doctors, to be in a position where you have to tell a mother, a son, a brother that you can't save their loved one because they cannot afford the care. So do not give up. This is too important a battle to lose. I will sum up with a final thought. When I die, let it be because medicine is unable to save me, and not because I'm unable to afford the medicine to try.